Hi there. Thank you so much for joining us on yet another edition of the program You're in Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Malaria is a major health challenge affecting people of all ages in Cameroon. According to the World Health Organization, Cameroon reported over 2 million cases of malaria in 2020, resulting to at least 1,000 deaths. To answer all our questions on malaria-related disease, we'll be having an expert who is a public health consultant. He's known as Dr. Ahmed Nfor. We'll get to him after the second part of this short break. Thank you so much for staying with us. As I earlier said, my guest today is Dr. Ahmed Nfor. He is a public health consultant. It's always a pleasure having you on the program today.
Thank you very much, Immaculate. Thank you, viewers of Equinoxe Television. And it's a nice day being at the Equinoxe station today.
Doctor, it's very obvious that cases of malaria keeps on increasing, not just in Cameroon, other African countries. Before getting to why this increase, I want you to first of all explain to us what exactly is malaria all about and how is this disease transmitted?
Malaria is a disease which is caused by a parasite known as Plasmodium, and is considered under a tropical and subtropical infection because it's more prevalent in the tropical environment. And malaria actually is transmitted by a renowned mosquitoes which we know, which is common in humid environment, known as the female Anopheles mosquito, which is very predominant in the tropical and subtropical environments.
From my definition or from my introduction, it's quite clear that everyone has a chance of being infected with this disease. But then, are there any particular age groups?
Actually, malaria is, there are people who are more prone to malaria. We have pregnant women. That's why pregnant women on their prenatal visits, they are placed on folic acid tablets, which helps to boost their blood production. Because of malaria attack, they are provided with mosquito bed nets, pregnated mosquito bed nets. So you have children under 5 years because their immune systems are still weak. And then people who are traveling, you know, we in a subtropical and tropical environment, we are a bit resistant to malaria as we grew up, but those traveling coming to these areas are very prone to malaria, and it may be very catastrophic and more destructive in their system than us. How does malaria manifest in the body? Yes, the signs and symptoms of malaria, before I come to that, there are statistics from most World Health Organization showing that out of 10 Africans, it's possible to have 6-7 tested positive for malaria. But as we grew up, some of the signs and the symptoms, some of the situation become asymptomatic. It doesn't show, but you test positive. But most of the symptoms we will observe, we have headaches, we have vomiting, we have joint pains, we have diarrhea, we have nausea, we have things like rapid breathing, sometimes bring coughs, and they have chronic abdominal pains we may result from malaria attack. These are the common signs we may see as a high fever. It can lead to shivering or chilling. But these are all indications of the Plasmodium attack in the system.
For those who would like to participate on today's edition of the program, You're in Your Health, here are the numbers 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Back to you, Dr. Ahmed. You already mentioned that pregnant women and children are very much more prone to being infected with malaria. Why this category of people?
Yeah, that's how I just, as I mentioned, is that, pregnant women are more prone to malaria or need to take more care of malaria because the system of a pregnant women, the immune system is a bit weaker. And then children below 5 years too, they have a weaker immune system. So in the cases of pregnancy, there is always pre-malaria drugs which are given to pregnant women. This is because they are more prone, their immune system has dropped in functioning than normal. So they need to get pre-malaria drug for prevention. Children lower than 5 years, their system too are weak. But as they grow up, their immune system becomes stronger and stronger, and they will show some resistance to malaria. Then those traveling, like people living in the temperate region where there are no traces of malaria or very small traces of malaria, coming into the tropics like in Africa, they are more prone because the system do not know this plasmodium. And so their system, they don't have system resistant to this parasite. So it is easier for them to be attacked by somebody who is living in an environment with already a malaria or an endemic environment with malaria.
Given that over 2 million cases of malaria were reported in the year 2020, that statistics was given by the World Health Organization, is there a need for Cameroonians to be worried?
Actually, the prevalent rate of malaria and the attacks of malaria as reported by World Health Organization for the past years in the areas concerned has been very alarming. It's keep increasing. But actually, there is no need to be too worried because the populations have well been educated on the strategy on how to prevent malaria attacks. And secondly, too, there have been a huge mass distribution of pregnated mosquito nets year in, year out to prevent this, and mass education. I think there's no need to worry, and we want to encourage too that if people are sound on how to keep the environment free of the transmitter insect, Anopheles mosquito, it could be easy. So at least any average African knows anything about malaria. They know malaria very so much. So there's no need to be worried. And in some areas, they know they had to manage when the attacks come up.
You highlighted some symptoms when it comes to malaria. Doesn't mean if someone notices such symptoms, they should just automatically say they have malaria, or there's a need for them to go to the hospital? Yeah,
there's always a need of diagnosis, consultation, diagnosis, and laboratory tests. This is very important because some signs and symptoms of malaria are very similar to signs and symptoms of typhoid and other health complications. Okay. So it's good to go to a hospital for consultation, and then the doctor will refer you for laboratory tests to be sure. And if it is malaria, we know the parasite is in 4 forms. You have the falciparum, which causes cerebral malaria. We have the malaria, Plasmodium vivax. We have Plasmodium oval. We have Plasmodium malariae. There are 4 types. So they need to dictate which particular type is there and which medications can be administered.
So that definitely means the types determines the type of medication you need.
Yes, these 4 types causes different 4 types of fever.
Wow.
So we need to diagnose.
How can individuals protect themselves from suffering with this disease called malaria?
Yes, one of the easiest way to protect yourself from malaria attacks is sleeping under mosquito nets. That's the first thing, individually. The second thing is you can use mosquito repellent spray, where you spray to repel the mosquito from the rooms where you have to sleep. There are also some ointment that people apply before sleeping. It repels mosquito. They are all good. And then secondly, make sure you wear long sleeve shirts, long trousers to cover your body when you are sleeping. This is protection in the house. We'll be talking subsequently. We'll be talking about the environmental impact, how the environment contributes to malaria spread. I think we'll come into that later.
Talking about this repellent you just made mention, I know an asthmatic patient who told me whenever this repellent is sprayed at home, she gets irritated with the insecticide, and also that she's unable to, like, she finds it so hard to sleep in mosquito nets, whereas she's pregnant. In such a case, what other alternatives can she rely on? Yes,
actually, what the patient was telling you is allergitivity. Okay. You know, when you already have some trouble with your lungs, like asthma, there's a possibility that the particles from spray can irritate you. And some people psychologically, sleeping under mosquito net, they have some psychological problems, you see, and then it's allergitivity. Now, in this case, there are many other options the patient could do. Close your doors very early, before 6 p.m., because mosquitoes always get to the night bed towards when it is getting to darkness. So you close your doors early, and then you can even spray the room and then remain outside, then come in to sleep. When they spray, the particles of the spray must have disappeared. You may not have the allergitivity like before.
Okay. So, but it's not necessary for someone to spray the room while there are people inside, right?
Not advisable, because most of this spray, they can be toxins to some people, and they can cause allergies in some other people.
As I earlier said, the numbers to participate on today's edition of the program are 670-547049. I repeat, 670-547049 or 656-622222. 656-622222. Back to you, Dr. Ahmed. Are there any potential side effects of anti-malaria medications, and how can they be managed?
Yes, what we're talking about, anti-malaria medications are medications that help to treat malaria, but they have some long-term effects in some people. Have some long-term effects in some people. You have things like artemether, which we're coming to it. Okay. Some people, when they take this injection, they could collapse, they could vomit. It could cause high fever in some people. It could provoke vomiting. It leads to fatigue and general body weakness in some people. And then in some people, you inject them automatically, they lose appetite, they don't eat. So there are some side effects. But the good thing is that most of these side effects are not long-term side effects. Okay. They gradually go away faster, especially when it comes to the one injectable anti-malaria medications.
What if someone, despite having malaria, stays back at home for, let's say, a month or two, or even much more longer? Are there any risk factors?
Yeah, there is actually risky. The dangers of malaria is red blood cells destruction, which can lead to anemia, because the parasite lives in red blood cells and multiplies in the red blood cells, causing the red blood cell to develop a crescent shape, making them functionless. And so when you step back with malaria, the rate of multiplication of Plasmodium is very rapid. It keeps destroying the red blood cells. You may end up suffering from anemia. And when you suffer from anemia, there's shortage of red blood cells, yes, which can lead to confusion, collapse, and even death. So getting treatment for malaria faster, it is better, especially in younger children.
The Ministry of Public Health for several years now has been fighting so hard to eliminate malaria in the 10 regions of Cameroon, but this fight seems not to be bearing fruit yet, because we still register several cases of malaria on a daily basis. Why the increasing cases? Is it that they're not doing enough, or more needs to be done?
Yeah, I think the Ministry of Public Health is doing actually wonderful work, sensitization, doing things and that, but I think the work is not still enough, because most rural environments still have many challenges. As we're saying, malaria is very predominant in cosmopolitan towns. Give, for example, Douala, where you have, when in cosmopolitan towns, especially in Africa, they are attributed to dirtiness, dirty environment. Now you see garbages here and there, you see potholes here and there, you see drainage systems that have been blocked where water comes and stands. This becomes a challenge because they all create breeding areas for mosquitoes.
We have a caller on the line. We'll come back to that question. Hello, good afternoon.
Good afternoon. I think when you have the malaria, you go to the hospital, the pharmacy, you give their signs, they just give you a particular drug. So they don't even examine whether it's which type of malaria or which one. They just give you a drug. Is it that there is a universal drug for the malaria, or what? I don't understand.
Thank you so much. Thank you so much for that question. And that's true. A lot of times when we go to the pharmacy, we just say we have been diagnosed with malaria. They don't even ask those questions, as you just rightly mentioned, on the form.
Exactly. So yeah, that's true. I've get what the caller is saying. Most people battle over the counter medication.
Exactly.
And there's what we call auto medication, where people feel some signs and symptoms and go for the treatment themselves. This is those selling medications. They don't have time for diagnosis. They are there to dish us medication. Those medications, we are not condemned. They are good medications. But the first thing is that what is disturbing us outside is that we end up treating signs and symptoms, not treating the risk factor, not treating the pathogen itself.
Wow.
That is where we have a problem. If you take a Ferragans and take maybe some few quinine tablets, over the fever subside, but it doesn't mean the Plasmodium has gone. So a proper diagnosis is very important, because most people, when they go with over-the-counter medication and other alternative therapies, they feel very comfortable that the fever has gone. Meanwhile, the Plasmodium is still in the system, but the symptoms have subsided.
Wow. And before the caller, we were talking about why this malaria still continues.
Yes, so I was saying that with the dirty nature of our environment, it's very difficult.
For example, Douala.
Douala, where there is a company who is in charge of garbage, and we are not seeing actually effective work done. Or maybe they are doing, and the garbage are more than the company, maybe they create another substitute to do this, because then the drainage system is very poor. When you come to like Douala Center or Yaoundé Center, you see very good drainage system. But as you start going into the interior, you realize that there are areas where the water, when rain falls, water dried in those areas after 3-4 days. This create good breeding ground for mosquitoes, especially the one which will spread malaria. So hygiene is one of the standards. That's why some people consider malaria as a disease for poor countries. You see, it's more prevalent in poor countries because most poor countries are attributed with dirty environment.
My technician is already informing me that our time is up. Thank you so much, Dr. Ahmed Nfor, a public health consultant. It's always a pleasure to have you on the program.
It has also been a very pleasure having this program this afternoon at Equinoxe.
I equally want to thank those who are right there at the audio console. We have Bertrand Bonzini and Jonathan Babila. We want to say a big thank you for all what you're doing. And a big thanks to our millions of listeners and televiewers. It's a pleasure to be with you all the time on Thursdays to talk on health-related matters. From us to you over there, have a wonderful day. Bye-bye for now.